Hi, everyone. Welcome once again to Eye Health Conversations with Dr. Okogbaa. I'm Dr. Okogbaa with Louisiana Center for Eyes in the Baton Rouge, Louisiana area. And today we're going to talk some more about our eye health. And this is purely for your information so you could be aware of some of the things that can happen with the eyes. And we want to keep them healthy and we want to keep them going strong. We want them to do what they need to do. Um, so let's begin. So today, let's discuss this condition called age-related macular degeneration. So, I'll have a patient that come in and say, "Doc, have you heard of something called mac degeneration, something like that?" And or my mom or dad had this, and I'm not sure what it is. And so let's dive in. Okay, so with our eyes, there are some leading eye conditions that can lead to blindness that are very important to know about, and macular degeneration is one of them. Over 2 million people in the United States have this condition, and it's one of the leading causes of vision loss in people over 50 years old. So that makes it a very significant condition to talk about and to be educated upon. Okay, so what is it? Okay, so let's start with the eye. So we always talk about, the eyes they are an organ of the body, and they have different structures. There are different structures within the eye, and each structure have different functions to help in the overall functioning of the eyes. Okay, so everything works together so they can help you see, right? And so we want each of those structures to work well. And so one of these structures is your retina, right? So the retina is that thin film behind the eye. It's very sensitive. So the image goes through the retina to the optic nerve and to your brain, right? And within the retina, we have an area called your macula. So your macula it's rich with cells, and it gets a lot of oxygen, a lot of blood flow, a lot of denseness to it, because that's the part of the eye that's responsible for our central vision to help us see fine details. So as I'm talking to you, I'm looking at the camera, I'm using my retina. I'm using my retina right now. I'm not looking at my periphery. I'm looking right in the dead center, and that's what the macula does. That's its job. And so when we have this condition called macular degeneration, we start having we develop these deposits called drusen within the macula that damages the tissue. And as it damaged the tissue, it slowly takes away your central eyesight, your central focus, your central vision. So over time, some people can lose their ability to drive because they can't see right in front of them, or it impacts their job because they cannot see the computer or see the paper in front of them or see the faces of their children. And so that's how important this condition is. And so there's two types of macular degeneration. 80% of macular degeneration is made of what we call the dry type, where we have more of this accumulation of this drusen or this damage, and it's a slow process that happens over time. And the second type of macular degeneration is called wet AMD, or wet macular degeneration. Means that the eye, along with the drusen and the damage, now we have blood vessels growing, abnormal blood vessels, excuse me, abnormal blood vessels that starts to grow in that area, and they leak, they can bleed and cause deeper and further vision loss. And so I just want you to be aware that these macular degeneration exists, that it impacts a lot of people. And so my encouragement to you is please get your annual eye exams. Even if you feel good, you're seeing great, get a baseline eye exam. It's always good to check in with your ophthalmologist to be sure everything is going well. Next time, we're going to explore who gets macular degeneration and how do we diagnose it. Okay, and so I will see you next time. Please share this video with someone you know who may benefit from this information. And if you have not had your eye exam in the past year or recently, please make an appointment with your ophthalmologist. And if you're in our area, check us out, call the office, or go to our website, www.lacenterforeyes.com. You can send us an inquiry there. We get you on the schedule and get you seen. Thank you so much and have a wonderful day. I'll see you next time. Bye.